Thank you, Colton. Okay, we will call the March meeting of the Kansas State Board of Nursing to order. And we do have a quorum. It takes 6 of us to be present, and we have over that. So we are fully functioning today. So, let's take a look at our on-site packet. There are 3 documents that are in your on-site packet for review. I think Carol will be talking about one of them. And then one of them is a supplement to the consent agenda. So hopefully you've had a minute to review that. And then the other one is an agenda item later on, and we'll be talking about that. Oh, no, I'm not seeing it on there. The regulation review process. Okay, so we need to add that to the agenda. So I think we do have some amendments to our agenda. So we need to add, we have some students joining us today for scholarships, and then we would also like to review the regulation reviews and how we're doing on those. We have a year to get that done. So there's a supplemental document in the on-site packet for us to review that. So we need to add those 2 agenda items. There's a motion to do that.
Madam Chair, I move to approve the agenda as amended.
Thank you, Becky.
Adri Goldsmith, board member, I second.
Thank you, Adri. Any discussion? All in favor signify by saying yes.
Yeah.
Any opposed signify by saying no. Motion carries. All right, announcements. We do have 2 board members. Michelle is here. She has a virtual commitment. She just needs a few minutes for, and then she'll be joining us. And then we have Lori Owen, board member. She has a commitment this morning that she could not get out of, but she will be joining us here in just a few minutes. So hopefully shortly after 9:30, she'll be joining us. Any other announcements that we need to make? Okay. We have our minutes for review from December. Take a minute to look through that.
Madam Chair, I move to approve the minutes from the December 13th, 2023 board meeting as written. Sharp.
Thanks, Brenda. We have a motion. Is there a second?
I'll second. Andrea Watson.
Thanks, Andrea. Any discussion? All in favor signify by saying yes.
Yes.
Any opposed signify by saying no. Motion carries. Okay. Next, we have our consent agenda. Hopefully you were able to read through those things. And like I say, that CE broker update was in the on-site packet. So you didn't have a long time to review that, but that was included for you. If there's questions or something there that anyone would like to talk about, we can pull one of those items out. If not, we'll entertain a motion for approval.
Adri Goldsmith, board member, I move to approve the consent item agenda, which includes the written update on CE broker, the written update on licensing software. We're doing all of those, right? And the RFP for impaired provider.
Thank you, Adri. We have a motion. Is there a second?
Second.
You read first. Michaela, second. Any discussion? All in favor signify by saying yes.
Yes.
Any opposed signify by saying no. Always good to have an even vote. Okay, let's go to our agency reports. Carol, you want to start?
Sure. You should have mine underneath the staff reports, as you'll have everyone else's too. I always start mine out with upcoming NCSBN meetings, and those are listed there. Mid-year is past now, though. Juliana, Adrian, and I went to mid-year. It was very good. So that was off. APRN roundtable, I think there's 2 of us going to it. It's virtual, so we'll be attending it virtually. The IT operations conference, Adrian and Tony will be attending that. The discipline case management conference is Linda. She'll be attending that. And then the executive officer summit, that is me. They do that every year for just the executive officers. And then we have an annual meeting coming up in August in Chicago, and then the NCLEX conference. And I think that's probably virtual again, September 12th. So those are the upcoming ones that I know of. I always put on their board members and their terms. You will see there's 3 of them that have red because they actually, their terms end the end of this June. And so just wanted to call that to everyone's attention. Regulation revisions, the 160-3-114 had to do with changes in the refresher course that you approved. That has been submitted, and so it's going through the approval process. The budgets for fiscal year 24 and 25, those have been through all the process. The budget hearings over in the Senate and the House went fine, no problems. So we'll just be waiting for the appropriations to put in the mega bill that they'll be doing here after the session ends. But I don't anticipate there would be any changes from what we've submitted. I just put the meetings that I attended. I'm not going to go through all of those. I did want to just kind of update you. I tried to put on all of these where they fit in the strategic plan. That's kind of helpful when we start, putting actions in the strategic plan. I wanted to let you know on the nursing apprenticeships, you had voted to support that. And I know there's work continuing to be done because I met with the Kansas Office of Apprenticeship and also Jaron again from the Hospital Association. And they kind of filled this in on their plans and stuff. So that is still moving ahead. Just to let you know, the whole U.S. Department of Education, we submitted a renewal application to be recognized as an agency for approval of nursing education. We've been one for, wow, before I came in. I soon will be here 14 years, so it's been a while. We have to do that every 4 years. And so I had to appear in front of the U.S. Department of Education Committee on February 27th. There were a couple of things that got debated. They tied the LMHT education back into nursing education. So I asked them to please separate that because we do not consider them the same. The LMHT has a different act than nursing. And so they did change our scope of authority to be just nursing education. So that's a plus. The downside to this, though, is when we had our last renewal, they come out and do a site visit and everything like that. We were fine. There was no issues or anything. They have not changed their requirements. We have not changed our practice. However, we got 4 deficiencies identified this time. And they all tied to the fact with the advanced practice that we didn't have what they considered all of the policies in place. We do the stuff. A lot of it has to do with what's reported with our annual report. And we have all the information, we just didn't have the policy. So the policy would actually be in regulations. So how they left it with me is we are approved. However, I have to submit a report in 12 months that shows that we're in compliance. So what that all means is the revision to the APRN regulations, which will cover all of the issues, have to be through the whole process in 12 months. And that's going to be pushing it. So I did, those revisions of regulations were looked at in, education yesterday and also in APRN, so you'll be hearing some of those come today. And if those revisions are approved, then I will start it through the process. But I also made it very clear to them that there's some of that process I have no control over. And so I'll do my best to get that through, but I thought it was very interesting because one of the committee members asked the question that I asked. The first question I asked when I heard about their findings. And the committee member said, okay, if I'm understanding correctly, when you were renewed the last time, our requirements were exactly the same. And your actions were exactly the same, and you were told that you were in complete compliance. And I said, that's true. And she said, so how can that be? So one of their staff came in at that point, and it basically came down to they're getting a little stricter, I guess. And I was in hopes maybe they would just kind of give us a little bit of a warning and say, you know, next time you're gonna have to have this, but that didn't occur. So I just wanted to fill you in on that, but we did get continued recognition as long as I do that report in a year and we're in compliance. So, projects. You know, the legislative bills and everything. I did something a little bit different this year for staff. I did a weekly legislative update that included bills that we were watching, bills that perhaps I have been approached for by fiscal notes and just the actions of them. And you have not the most recent one, but the week before in an on-site packet. So you can kind of see what that looks like. I think the staff I've heard some feedback that they like it because it's very difficult to track everything over there. So unless you do it like on a daily basis, it's very difficult to keep up. So I did that, but I also wanted you to see an example of it, knowing there's been a lot of things going on over there this week, so it's not up to date. There is one bill over there that causes some concern. Well, there's actually two that will affect us. One has been all the way through the legislature, and I believe is waiting for the governor's signature. It has to do with licensing of active military and military spouses. For those two groups, we will waive all licensure fees, which would also include fingerprint fees. Now, just rest assured the numbers are not real big because we've been monitoring the number of military for a couple of years due to another bill that we have to submit a report to. So the numbers are not high, but that's the first group that we've ever waived licensure fees for. So it probably will require a little work with our licensure software because right now you can't pick out one license type and say, we're not going to do fees for those. So we're going to have to probably create another license type that would be like RN military, you know, something like that, so that we can just not tie any licensure fees to that particular group. So it's going to require a little bit of work. Again, I think it's been through both chambers and it's probably waiting for the governor's signature. And then the other one that causes some concern for us is House substitute for Senate Bill 291. This one kind of came out of nowhere almost and went through pretty fast. But what they're basically trying to do with that, they're addressing cybersecurity, but they're also wanting to take IT personnel from agencies and put them back into the Office of Information Technology Services, which is a main office. So that will have a big impact on us. It did make it through the House last night. I got notification about that. It hasn't been through the Senate. It started on the House, but I'm not sure what's going to happen with that one. But, you know, there's been a lot of work on cybersecurity and everything, which makes a lot of sense. considering everything that's going on in the world now, but it kind of, that can have a big impact on us. So we'll be watching that definitely closer. Just kind of let you know, Department of Children and Families, they, were working some proposed regulations that had to do with juvenile centers. And they actually had the wrong content in there for the scope of practice for APRNs. They still have them working under a collaborative agreement. So when they had their public hearing, I went over and testified with the recommendation that they change that to have the correct scope of practice in. And I believe they're going to do that. I don't think they realized that it had changed. So they must not really have looked at the Nurse Practice Act. But anyway, just to let you know, followed up on that. And then what's also in my report is you had talked about this in the strategic retreat that you wanted us to do like a one-pager for the legislature. We did this last year. And we also, what you have in there is what we did for this session, 2024. And it actually was distributed to both sides. So they all got this. So didn't really get any phone calls, anything like that, but we gave him the information. And then I also put in there, you know, there's a lot of questions and everything about nursing shortage and everything like that. There's an interest in bringing more foreign educated nurses into the United States. So CGFNS is the credential verification company that we use for foreign educated nurses. So they did this report, nurse migration report for 2023 that I just thought you might find that interesting. And then the other thing that's happened since my report was done is there is a subcommittee over there that will be meeting next week. And the subject is contract nursing. And so they're talking to a lot of different agencies, groups and everything. I think what probably originated some of this is the high cost to the state hospitals for the contract nurses that they have to use. And it is very costly to the budget, I know. So I was asked to submit testimony of all the licensing requirements for nurses in the state of Kansas, and then actions that KSBN has done to address the nursing shortage. So the testimony will be given, I'll take it over tomorrow, and then the hearing that I have to go to is April 3rd. So I'm not sure if anything done with that, but anyway, I don't think that's all I have. Any questions for me?
I had a question on the military deferment of, is that for the initial or is that forever?
Henry.
And does that cover additional things like multi-state?
Yes, it would, because it's not really part of the compact, you know, statutes and everything that we have to charge a fee. It says, I think that they'll meet the licensing requirements of the state. So we would, yeah, any license fees, we would be absorbing that cost, and that doesn't include fingerprints.
Do they have to show that their spouse is continuing to be active?
Yeah, we will have to, yeah, we'll have to,
Because once they get retired,
right, and that's different for us. You know, I don't think right now we ask for active, I'm looking at Ray. But this would be something that we would have to have proof of that, yeah, so.
Okay.
There's a few things that would have to change for us for that.
Let me check the, just really quick. Good question, Patrick.
Any other questions for Carol?
Yes, our questions do not ask if they're active. They just ask if you are a military service member or spouse of a military service member. So we
So
might
that
have to
would-
change that.
Yeah, that would change, and then the renewal process, we would have to know that to be able to renew. So there's some things that would have to be worked out.
Okay, thank you very much, Carol. Adrian?
Okay, thank you, Madam President, members of the board, Adrian Guerrero, Director of Operations. You have my report. I'll be brief. A couple items that I wanted to point out. I wanted to highlight the continuity of operations plan again. I know we just brought this to you in December, but it's actually time for us to do it again. The state had an influx of every agency essentially was submitting their continuity of operations plan at the same time. So the emergency services team was basically overloaded. So now they've kind of picked people to be in different quarters, and we happen to be in the first quarter. So we are working to do a small update to that. We held a tabletop exercise with staff, all staff, on March 6th, and I think it's on April 3rd. Next week, we're going to do kind of a after action debrief of some things that we identified as areas to improve. But if anybody's interested, I did bring down one copy. I think eventually we'll give a copy to the sitting president. But it's something that we will be using, and we're going to be training the leadership team on various aspects of that. On the HR front, we've done a few interviews here and there. We're still working through all the changes. We had the Assistant Attorney General, an RN investigator position, a part-time investigator, and then a senior administrative assistant and investigative that we're currently recruiting for. And I'll let Linda give some updates about her area on that when it's her turn. As you heard, cybersecurity is a big thing. We're going to be talking about it a little bit later on today, but I did want to highlight this part in the meeting so that everybody knows. You should be getting an email asking you to do your cybersecurity annual refresher course. Board members are considered employees, so to speak, of the state. So it is a requirement, and any audits that we have done, we have to show compliance. So some of you have completed it. If you can do that before the next board meeting, that would be most appreciated. It is about 20 some modules long. It is rather entertaining this year. Kind of a funny one.
We did it.
So
It's better.
it's actually a little better, I think, but you can start and stop, if you finish a module, you can come back later. So you can kind of stretch it out if you need some time to do it. But with that being said, the information security officers, myself and Carol, and then the teams have been working on various policies for cybersecurity compliance. It's consuming a lot of time. I did some calculations and found that last year I spent 411 hours on just cybersecurity related policies and governance and reviews and that sort of thing. And so we're making it a big focus of ours. So it's just the world we live in now. So the other thing that's kind of a nice thing, you've read the report about the licensing system. So we're working on that. That's a big project for us right now. But we have made a lot of room in clearing out another facility that we have where we have some records stored. In the back of the report, the company that did the shredding for us kind of gave us some interesting statistics, I thought. But we essentially have securely shred and gotten rid of some things. It was 756 boxes, or about 26,000 pounds worth of documents that were securely shredded. And then they kind of break it down, showing you how many trees and stuff you saved. I thought that was kind of interesting. But did have one thing to report that's pretty good. We still have about 150 boxes yet to get scanned and cleared out of that area, and was happy to find out last week that we did receive another grant from the state's digital imaging grant fund dollars at the tune of about $64,000. So that's going to help cover that, so that there's no expenses. So they've been very generous, and we've been most appreciative of that. So we're going to get that going here hopefully soon and close down that location, which will reduce some costs for us, which is nice. And then other than that, I guess that's it. Yeah, we'll have some
Thank you,
questions.
Adrian. Great report. Any questions for you? I'm gonna welcome Michelle. Thanks for joining us, and Lori's now on as well. So we're glad you both have jumped in. So thanks so much. Janelle, do you wanna go next? She has a weak voice, I believe, so.
Madam President and members of the board, Janelle Martin, Education Compliance Officer. Thank you for allowing me to join remotely and keep everybody from some germs here. So I just have a couple quick things I wanted to point out from the report. We have had another new application submitted from Chamberlain University College of Nursing. They have submitted a letter of intent to establish a campus in Kansas City, the Kansas City, Kansas area. We will be expecting that to come through sometime this summer. The University of Kansas has several changes. They have a new dean for their School of Nursing that will be starting mid-April. Sally Molesky, who's been the dean for many years now, is retiring, and Jean Giddens will be taking that spot in mid-April. Also, longtime program director for the nurse anesthesia program at KU, Donna Knight, is retiring. They have not announced a replacement for her at this time. I think the report, we've had a lot of site visits again, so the report is pretty short in that it explains what we've already done. I still have 2 more site visits to do in April, and then we'll finish up, I think, for the spring. We have a full plate for end of summer and for the fall. So looking at that, we Carol was mentioning CGFNS and what they're doing with foreign nurses. We are still reviewing quite a few CGFNS reports every quarter. We had 21 this quarter. The Philippines seems to still be our top contender in terms of where we're getting nurses from in Kansas. And I kind of like just to keep track of that. And most of the applicants are RNs, but we do get a few PNs as well. Just wanted to make a note. I've been tracking the FQRs. This has primarily been because of some questions about how our regulation works. As I've done site visits with our national nursing accreditors, there's always some questions about, we have a regulation that requires the MSN for RN programs, and we do have a degree plan exception for our clinical faculty if they're hired. And then we also have a higher exception process, which not every state has. And so there've always been some questions about how that works. So I've been trying to track that. And that's what you see in the report that the table is. And it just right now, I wanted to point out that for the first quarter, half of the FQRs that I received did not, the faculty did not meet regulation up front that they had to either have a degree plan or a higher exception. So I think the impact of COVID, and not only the number of students, but our nursing faculty, has continued to be felt. We feel like we're in somewhat of a recovery. We have more degree plans again than we've had in a while, so that is encouraging. The only other thing I'd like to mention is our annual report will be coming up soon for all of our programs to be completing. We are working with NCSBN on that there's a core part survey to the annual report, and then we have a portion of it that's our own questions that we are required by the Department of Education to complete as well. And so we're looking forward to that. We also have a new updated annual report from NCSBN that we will be able to use as some comparison for how Kansas is doing. They now, I believe, have over 20 states that are involved in that core survey. So the data that we're getting is from several states, and we're able to look and see how we compare. And on all the core pieces of nursing education is what it pertains to primarily. So I think that's all that I'd like to bring forward. If anyone has questions, I'd be glad to answer them.
Thanks so much for being here, Janelle, and for the report. Just please take care. We hope you feel better.
Thank you.
Okay. Ray, like to go next?
Sure. Okay, so in my report, we started out, The total number of the new licenses that we issued between the last board meeting and this meeting, and then I included, the renewal statistics of each month. The one thing that I did different at the very end, Brenda, you had asked last board meeting to kind of see the differences of the total increase and decrease to kind of see where we were at. So I did include that for the license types for total nurses in Kansas. And that was the only thing that I did different, so. And I'm gonna continue to do that if you guys kind of want to see where the trends are going. Yes,
Very interesting.
okay. Well, and I think you'll see, especially with that jump for the multi-state, but then you had the decrease for the single state. We did have December graduation class in there. So that absolutely affected that. But that's all I have for you guys.
Any questions for me? Great report. That's really helpful. We talked about the increase in the number of licenses and in the finance committee, and so it's good to see that breakdown in those numbers. So that's great. Thanks for doing that. Okay. Linda.
Thank you, Madam President, members of the board. In your packet, under staff reports, you'll find my practice specialist report. The first table, I always have this on here for you. It shows the cases by statistics by year. Excuse me, we still have a lot of cases open. On Monday, I was reminded that we needed to kind of report out data that we had, like the type of cases that we had reviewed and the violations and or disciplinary action that had been determined. So I gathered that last night. 65 cases were presented to the board for probable cause termination, and in this quarter, 45 cases were inactivated by staff, which most of those had failed to meet the violation of the Nurse Practice Act, or we didn't have jurisdiction, meaning we didn't have a license for the board to consider disciplining. We had 36 complaints that were reviewed that failed to also meet that threshold to even open a case. We had 24 application cases that were closed, and we had 28 cases that involved unlicensed practice. So total investigations processed this quarter were 198. And these cases have not been removed from the total counts on this chart. We are cleaning up past cases, and like 2017, it's down 10. We finalized 10 of those cases. 2020, we finalized 8, so it's down to 124. There are still the 2 in 2016, and I think that when I talked to the investigator, they're like mostly imposter cases, so we'll have to figure out how to get documents, things of that nature. 2021, it's down 6 from last time. 2022, it's down 10. 2023, it's down 16. So, and we still get an average about 10 complaints per week. So even though we're trying to close cases, we're also opening cases. So it's kind of, hit and miss, but total cases currently assigned to investigators, it shows 1,312. This is up 131 from what we reported in December. So staff are certainly opening cases and getting them processed and started. And so as you can also see, like I said, complaints are still coming in. Complaint allegations for the calendar year 2023 to 2024. I put that in for just kind of reference. And the pieces that really are standing out to me are those of significant investigations or significant allegations of negligence, impairment, and abuse. We look at those because those seem to be the type of case that could either warrant patient harm, did result in patient harm or patient death, or had an increased arrest. And, would also be the type that would potentially get media attention first before it's reported to the board. So, but we are still running about 20% of complaints are sworn. We're still doing education on that. I also find surprising that, the failed to follow facility policies and procedures, about 37% of our cases that are reviewed and go through the board. That's one of the violations that they are assigning. And this appears significant, and I'm not quite sure what the root cause of it is, because we know when I talk to students, they're not sure where the Nurse Practice Act is at, and they don't know how to read it, how to interpret it. And I'm wondering if they're reading the policies and procedures at their facility, or if there's enough time during orientation with their mentor, things of that nature, to where it allows for them to really truly understand what their facility is wanting them to do. So it's concerning. I also know there's turnover of staff and agency staff. Do they allow for, you know, people to understand the facility policy and procedures? I don't know. Those are my questions. And you know, I also look to see, is it related to the type of facility, a hospital, medical center, critical access hospital, or, you know, a long-term care facility. So excuse me. In December, you know, I reported that, you know, the students appeared to not understand and not know where to access the Nurse Practice Act. And I was requested to look at the differentiation of a new drug diversion case versus the relapse of a same drug. Still have not figured out what type of data I have access to be able to really truly hone that down, but that is on my list. The next table that you see is the KNAPP statistics summary. That's about the same in December, and I'm gonna say, you know, we asked for what educational opportunities could exist, so be careful what you ask for, because you get something. I got put on a committee that KNAPP formed, and it's been very good. It's comprised of KNAPP executive director and their program manager, as well as myself, and then the KU Med Center, a pharmacist who specializes in substance use and the controlled substances, as well as their senior risk manager. And the goal of the group is to educate on impaired healthcare, and not just nurses, but in general, so that we can hopefully prevent. And we also are addressing stress and mental health issues that are relating. This group, the first meeting that we went to and presented was to KU Med nursing leadership in the end of February. And from listening to their conversations, there's a lot of guilt in reporting from the nursing leadership. They don't want to believe that the audits are showing that this nurse is a good nurse. They wouldn't do this. So there was a lot of conversation as to sometimes you just need to believe the numbers and just go ahead and report and let the investigation go forward, so that, you know, we can get this person some help. And then one nurse leader, she did say that the nurse that she did report, which she was, you know, didn't want to, but she said that the nurse finally came up to her and thanked her for reporting and saving her life, because that's what she felt. So it kind of is a win-win at the end, but it's a very difficult process for everybody involved. So it's, you know, we're going to get ready to do some more education. I think we're going to a school of nursing here in the next couple of weeks. So we'll probably learn how the students are responding too. So, but that's a good committee to kind of like, you know, I'll give you reports to see kind of where we're at and what we're doing. I think investigative committee asked to see if we could potentially record that and put it on our website or something. So we'll be looking at that. The processing standards for the second quarter, these are based on the performance-based budget. Carol always wonder where we at. So the percentage of complaints, you know, we are still at over the 90% metric, which is great. Our process that we had changed to July 2020 is still working, so we're still meeting that. The percentage of investigations completed within 9 months of opening is at 55.3% for the second quarter. Our metric is 60. This was discussed at length in investigative committee on Monday. And the report, I'll let you just see it. It's in the investigative committee packet if you want to pull the report up there and review it. You know, I'm concerned because it's like trying to clean up cases. Are we going to truly be able to meet the 60% all the time? I also understand that, you know, it doesn't look good to change a metric, you know, midstream and try to figure out how to then meet something. So I don't know where the 60% came from, but Brenda reported out that our trend though is showing an upward positive trend. So the things that we are trying to change internally is reflective and that we're trying to get to that 60%. So that gave me reassurance that we're trying to get there. But I just, you know, I guess I'm just a little nervous Nelly about it. So I want us to be over the 60% and I just don't see it. So I'll continue to report that process to the committee. Let's see, let's see. Oh, let's see, we had 26 unlicensed practice for the quarter and 0 imposters. Yay. Open records, for the fiscal year 24, 94 requests and 90 were completed. It's an averaging of 9 days, to produce. I do have one, that is waiting on a disciplinary outcome before I can report. It's to another state board of nursing. And I have one that's wanting data, and I don't have access to data, and so I'm waiting on how I respond to that. We also are going to go live with this art case, software system mid-April. I'll let you know in June, how that rolls. And then the KiteWorks, that we implemented and started in January, it's being used for productions of documents on a record request. And it's also being used to have facilities send their documents electronically in response to a subpoena under case investigation. So that's going well. There still needs to be some education, I think, on all sides so that everybody kind of, it's better streamlined. And we're working on that. As Adrian mentioned, vacancies, we have the senior administrative assistant, and I'm still covering that position. I do have an investigator taking the phone calls and checking the voicemails, and another, and Jill's also helpful with doing some pieces for that as well. And then I do have nurse investigators, and we have 4 that have applied for either full-time or part-time, and we're getting ready to interview. So if they, we'll set those up here in the next week or 2 to finalize those. Practice calls, you'll have the report, I think, is in the practice committee report, but we talked about the IV hydration clinic. Board of Pharmacy has started a committee / task force to review, define, and possibly draft some education on this topic. Their concern is centered on where are the medications coming, because the Board of Pharmacy approves the dispensaries for the state of Kansas, and they're not sure that all these clinics are dispensaries. And so that's their piece, but we're on it along with BOHA and Board of Pharmacy. I think Carol and Charles first started. And so it's now myself and another nurse investigator on this, and the practice committee had some good comments yesterday, so I'll just keep them updated. We still average about 75 to 80 calls per month. So I'm hopeful that we can get an FAQ updated as well and put that on the website. And that might decrease some of that. So the investigative committee, we did an after action again yesterday, or on Monday, I guess it was, to figure out how it's going with meeting every 6 weeks. And it seems to be, there's a few things that we're working on, but it seems to be doing okay. They did mention that they say that it's time consuming for staff. And that's very kindly appreciated, because it is. But well, it's working fine. We're getting cases processed, which is good. Assessing the operational efficiency, that's still going on. The staff meet every first and third Wednesday of the month, and we brainstorm on ideas and we'll figure out, what works, what doesn't work. So it's a very good discussion. The meetings that I've attended are there. I also did attend the mid-year meeting for the NCSBN virtually, so I learned a lot on the education of things. So I thought that was very helpful, and I'm looking at things from a different perspective. So I appreciated that. So that is my report. Sorry, it was nothing.
Linda, I appreciate the statistics. I know we've said this several times, but the transparency that your group has brought to this and the improvements, I think, is phenomenal. And I think it's great. I'm pleased to hear, as you went through each of the cases that are currently open from previous years, you've made action in each one of those. And, I know that you want to achieve every single one of the targets. That targets are there to challenge us, and that if we achieve them all, then we may not be progressing. So I applaud the work that you and your team have done, and I'm not upset that we're not at the 60%. It gives us some work to continue to make improvements and work toward, and I think you're doing that. So great job. Thank you. Any other comments? Anyone?
I have a question.
Yeah, Giovanni.
Linda, just very quickly, on the number of nurses practicing without a current license, you reported that there's 26. Are employers notified that these nurses do not hold a current license? And what's the reason of these nurses practicing and continuing to work without a license?
I think when the unlicensed practice cases are presented, a lot of them are finding out that their license lapsed. Very few. There was a time where there was a glitch in the system and they would process, but they didn't pay because there's a second step. But we're not seeing that as much as that they're mostly just forgetting. It's not even just young nurses, it's older nurses who have renewed before. So employers are being notified. I've got this nurses be notified. And so we've got flyers now that are specific to employers as well as to individuals, licensees. So those flyers will be going out to the employers as I find them and then get them notified to sign up and put in all of their licensees. So they are timely notified when this nurse is licenses, anything happens to it, not just that it's like lapsed, but did it get revoked? I mean, we've got nurses who don't tell their employers, you know, when something is happening to their license either. So, and yes, we have facilities who are not checking their licenses when they first hire.
I
So
would like to add that that's getting worse than it has been in 10 years ago. Employers are not checking up on hire or the renewal. And so the new system that we're trying to communicate to them, which is e-notify, very simple for them to start doing that. They are increasing in numbers, unlicensed practice.
Typically just seeing a few days of unlicensed practice, or do you see longer, some longer stints?
We've had some incredibly long one, you know, it's increasing from the 8 years that I started on this committee, when you had very few, and now they're even longer term.
we even had a nurse educator.
Yeah, we
Yeah,
had.
I think we talked about that.
Yeah, she even had her session.
So that was
Yeah.
interesting. So
So
yeah.
do you
Not
think
this
the delay we had with the COVID where they could delay it might have had any impact on that? Just curious.
You know, we saw that initially
We
and we
did.
anticipated that. So we were trying to get that word out to everybody as soon as we could. And we anticipated a lot of reinstatements because of that. But at this point, because that was back in August of 2021, so here it is, March of 2023 to 2024. What year am I in? 2024. So I'm thinking it will pass that. That's already been another renewal cycle. So we should well be past that type of an excuse. So.
Madam President, Adrian, one of the things that we're looking at with the new system enhancements is to try to figure out ways that maybe we can push notify back to the nurses themselves. You know, right now they can track their status online, but it would be, you know, trying to figure out a way to go back to the nurse, which is why we're advocating so strongly for nurses e-notify, because that technology already exists. So NCSBN has some, what they call web services, APIs that we can attach to, and we'd like to do that with the nurses e-notify so that, you know, because what happens is people get busy, they maybe have licenses in different states and they just forget sometimes. And although we do send a postcard and all of that goes to them, they may not necessarily see it. So if we can capture that, then maybe they'll know right at that end of time that they've lapsed and then would have to reinstate.
We also, the nurses are required to update their contact information within 30 days.
Yeah.
And so, you know, it's a hindrance when that's not done. And so I know postcards are sent to their last known mailing address that's in our system. And if it's not current, and that's one of their excuses, it's not really an excuse because then they violated then the other piece that's, they didn't update that. So we do try to like communicate when we get a hold of them. We send a letter, but we also make a phone call and we also send an email because the younger generation is quick on the email, quick on a text type thing, but they're, you know, not going to check their mailbox very often. So I don't have an answer. It's all
I think
over.
it's collaboration. I appreciate the work that you're doing and going out and educating about e-notify. I would say from an employer perspective, it does get difficult because it is keeping that data bank up to date and entering every new nurse and taking out those that have left. And if you think about the nurses that work at a facility, I mean, there are many in all different aspects. And so it does take FTEs to monitor and keep that up. But I think educating and partnering with the employers and working with nurses as well to maintain knowledge of the Nurse Practice Act. And it's like renewing, you know, you've got to tell the driver's license agency, you got to tell the your licensing board, you gotta tell everybody. So, yes,
It's gotta do it, it's ultimate, and blaming HR is not the reason.
that's exactly right. It's a partnership and a
It is.
collaboration between all parties. And so I think you're doing that. And I've heard a lot of good things out in the community about presentations that you've done at statewide meetings, risk management meetings and those kinds of things. So I think you're doing the right things and you're getting that information out there to those that need it. So,
I have met with like risk managers, but I did also just this quarter hook up with the KDADs through their Sunflower Connection. They send a newsletter, quarterly newsletter to all assisted living, nursing home, long-term care facilities, because I've been trying to figure out how do I get into that group. And so I sent all the e-notify information to them so that they can get it into their newsletter. So hopefully that will also then help generate some, responses back to where we can do some more education to that group.
I'm gonna have Michelle bring down those flyers and hand one out, and then please, everyone in the audience, take.
That'd be
one
great.
back.
Yeah, that'd
We
be
should
great.
know that. I didn't think
You're not aware of e-notify. Linda would like it if you used it.
Yes, she's doing a wonderful
So,
job
yes.
getting our message out.
Yeah.
So thank you very much, Linda. I appreciate your work and the work of your team. Okay. About 10 after 10. How's the group doing? Do we need a break? That'd be helpful. Okay, we'll take about a 10-minute break, come back about 10:20. That's how we do. All right. Good to go?
Yep.
All right, thank you very much. Okay, we have some recognitions to do, so we'll pause for just a minute here in our agenda. I think we have some guests joining us. So every year we do the nursing scholarships for students, and there's a group that write an essay. Some of the colleges have their students do it as a project, some of them just do it on their own. But we offer a scholarship and to 4 recipients each year, and the topic is, it changes periodically. We're still doing the COVID topic, is that correct, Janelle? So it's how did COVID impact the nursing shortages and the workforce that we have. So there was an increased number of not scholarships, there was an increased number of essays written this year, and it is very competitive. I was not one of the reviewers this year. I have been in the past, but they do. It is a blinded review, and so their board members, several of you I'm sure did this, read all of the essays and score them out in a blind fashion, and then that all goes back to Janelle, and Janelle tabulates all of those scores, and we come up with our 4 winners. And it's not an easy process, and to be one of the 4 finalists is phenomenal because their writing skills are exemplary. So it's hard to be one of those reviewers, and for those of you that did it, we appreciate that. But we'd like to recognize our 4 recipients. So if you'll come up and join me when I call your name, we have Melissa Jackson from the PN program at Hutch Community College. Congratulations, Melissa. Yeah, that'd be great. Sandy is program administrator. Would you like to join us too?
Janice join us too, one of my faculty. Is that
Sure,
okay?
sure.
More than any.
Well, she's glad to have my picture there.
Congratulations, though.
She's been there almost as long as I've been there. That's a long time.
Over here.
Is the dollar amount all the same for all of them?
It is, it's $1,000 for each, and there's,
Oh, join us over here.
Oh, we're gonna go.
Yeah.
it's $1,000 for each, and there's 2 PN and 2 RN.
You stay, yeah, you stay. We'll recognize all of you. Melissa, you can stay up here. Okay, our next one is from David Jennings, also PN program, Hutch Community College. So that's impressive to have 2 college. Wow.
That's our first time I've ever had 2.
That's great.
One.
Good job.
Congratulations. Yeah, nice work, David. Okay. And then we have Ross Kate Mura. Am I saying that right?
Rose Kate.
Sorry?
Rose Kate.
Rose Kate? Okay, and Rose Kate is from North Central Kansas Tech College, RN program. So great, come on up. Thanks for your work. Yeah, sorry. You guys are funny. And Haley Hughes with Newman University, RN program. Ashton's here. Congratulations. Yeah. Yeah, yeah.
Yeah, I would just like to add to this, for the scholarship winners, your pictures and your essays will be in our next quarterly newsletter. that will be available online, so it's not something that you have to subscribe to or anything. And for those of you who want pictures emailed to you or something, Adrian will get you his information or something, and we'll be glad to do that. But thank you all for coming. That's a great honor.
Thank you for your commitment to nursing. It's great to see new faces. Okay, let's go to our committee reports, and we'll start working our way through this. So for Education Committee, I might hand the meeting over to you. Okay. Got several motions here to make, so.
For the education committee.
So we had a great meeting yesterday, and we discussed a lot of things. I don't know that I have anything specific to point out other than what is covered here. We have a lot of motions and a lot of actions that took place. We did get through the APN revisions, and we're bringing those forward. So that's in our motion. So I really don't have anything extra to add. Okay. It was moved to approve the consent agenda items, which included draft regulation review KAR 60-2-101 and KAR 60-2-102 and 60-2-103 and 60-2-104 and 60-2-105. The 2024 site visit schedule, and then the petition summary from 11/11/23 through 2/23/24.
There's a motion. Is there a second?
I'll second.
Any discussion? Anyone abstaining? All those in favor say yes.
Yeah.
Opposed? Motion passes.
It was moved to accept the initial site visit report for Mid-America College of Health Sciences PN program with recommendations. Program to continue on initial approval until the board reviews all recommendation responses with receipt of documents to Janelle Martin, and with another site visit to occur before next admission.
Motion, is there a second? Second, Sharp. Any discussion? Anyone abstaining? Favor say yes.
Yes.
Opposed? Motion passes.
It was moved to accept the site visit report from Highland Community College LPN to RN program and reapprove the ADN program for the time period of national accreditation.
Do I have a second?
Michelle Terry, second.
Any discussion? Any abstentions? All those in favor say yes.
Yes.
Opposed? Motion passes.
It was moved to accept the site visit report with recommendations for North Central Kansas Tech Beloit ADN program and reapprove for a time period consistent with the national accreditation.
Is there a second?
Sandra, I have a second.
Any discussion? Any abstentions? All those in favor say yes.
Yes.
Opposed? Motion passes.
It was moved to accept the initial site visit report with recommendations for Allied Health Career Training Program to complete all responses and submit to KSBN for review at a subsequent board meeting, hopefully in June.
Is there a second?
Michelle Terry, second.
Any discussion? All those in favor say yes.
Yeah.
Opposed? Any abstentions? Motion passes.
It was moved to approve the site visit report for Butler Community College ADN program and reapproved for the time period of national accreditation.
Is there a second?
Burkhart, second.
Any discussion? All those in favor say yes.
Yeah.
Opposed? No. Any abstentions? Motion passes.
It was moved to accept the major curriculum change request from Cloud County Community College ADN program to eliminate NR 114 and NR 115 pharmacological courses at 2 credit hours each and create a new 4 credit hour course in our 116 pharmacology and will be offered in face-to-face and hybrid format starting in the spring of the 2024 through 2025 academic year.
Is there a second?
Sandra,
Any discussion? All those in favor say yes.
Yes.
Opposed? Any abstentions? Motion passes.
It was moved to approve the major curriculum change request from Washburn University BSN RN to BSN PMHNP certificate graduate DNP to change the School of Nursing mission statement.
Is there a second?
Michelle Carey, second.
Any discussion? All those in favor say yes.
Yes.
Opposed? Any abstentions? Motion passes.
It was moved to approve the major curriculum change request from Washburn University BSN program to change the current curriculum by removing the 1 credit hour course NU 441 level 3 seminar course and create a new course NU 360, which will be part of the leadership courses incorporating the essential competencies.
Motion, is there a second? Second, Sharp. Any discussion? All those in favor say yes.
Yes.
Opposed? Any abstentions? Motion passes.
It was moved to approve the major curriculum change request from Washburn University graduate program to revise the DNP program outcomes as presented.
Is there a second?
Heiston, second.
Any discussion? All those in favor say yes.
Yes.
Opposed? Any abstentions? Motion passes.
It was moved to approve the major curriculum change request from Bethel College BSN program to change NSG 310 nursing dosage calculations from an in-person course to a hybrid course.
The motion, is there a second?
Gordon, second.
Any discussion? All those in favor say yes.
Yes.
Opposed? Any abstentions? Motion passes.
It was moved to approve the major curriculum change request from University of Kansas graduate program to change the course title, credit hours, course description, and objectives of course NRSG 809 health promotion to focus on determinants of health and remove complementary therapeutics, which are covered in other coursework.
Is there a second?
Michelle Carey, second.
Any discussion? All those in favor say yes.
Yes.
Opposed? Any abstentions? Motion passes.
It was moved to approve the major curriculum change request from University of St. Mary's BSN to RN program to remove the 0.5 credit additional lab from NUAT 340, NUAT 441, NUAT 542, and NUAT 325 from the BSN curriculum.
Is there a second? Any discussion? All those in favor say yes. Opposed? Any abstentions? Motion passes.
It was moved to approve the major curriculum change request from the University of St. Mary's graduate nursing program to revise the graduate program curriculum to include 4 courses and to include a new mission statement.
Is there a second?
Burkhardt, second.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed? Abstentions? Motion passes.
It was moved to approve the major curriculum change request from the University of St. Mary's master's program to add an FNP postgraduate certificate and a nurse educator certificate to our program options.
Is there a second? Second, Sharp. Any discussion? All those in favor say yes.
Yes.
Anyone opposed? Any abstentions? Motion passes.
It was moved to approve the major curriculum change request from the University of St. Mary's practitioner program to add a PMHNP concentration and psychiatric mental health nurse.
Is there a second?
Sandra, I'll second.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed? Abstentions? Motion passes.
It was moved to approve the major curriculum request from the University of St. Mary's Master's Program to add a PMHNP postgraduate certificate.
Is there a second?
Burkhart, second.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed? Any abstentions? Motion passes.
It was moved to approve the major curriculum change request from Mid-American Nazarene University BSN program to change course titles, change course description, and alter credit hour changes as presented. Also adapt sequence of courses, align the ABSN and the TBSN course numbers and title descriptions to be able to offer didactic courses in a hybrid format.
Is there a second?
Michelle Terry, second.
Any discussion? All those in favor say yes.
Yes.
Opposed? Any abstentions? Motion passes.
It was moved to approve the major curriculum change request from Newman University BSN program to eliminate NSG 4031 Advanced Principles of Aging and add NSG 4024 Adult Nursing Care 2. Reduce credit hours for NSG 4054 Community Nursing from 4 to 3 credit hours. Change NSG 4136 Adult Care 2 for 6 credit hours to NSG 4125 Adult Care 3 for 5 credit hours. And then finally eliminate NSG 4192 Senior Seminar 2 credit hour course and implement NSG 4133 Transition to Professional Practice, which is a 3 credit hour course.
Is there a second?
Burkhart, second.
Any discussion? All those in favor say yes.
Yes.
Opposed? Any abstentions? Motion passes.
It was moved to approve the KSBN articles pertaining to the Education Committee as written.
Is there a second?
Tyson, second.
Any discussion? All those in favor say yes.
Yes.
Opposed? Any abstentions? Motion passes.
It was moved to continue approval of KSA 65-1115 as written.
Is there a second?
Sandra, I'll second.
Any discussion? All those in favor say yes.
Yes.
Opposed? Abstentions? Motion passes.
It was moved to continue approval of KSA 65-1116 as written.
Is there a second?
Michelle Terry, second.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed? Abstentions? Motion passes.
It was moved to approve Fort Scott to be allowed to admit 20 students in the fall of 2024 to pilot the changes. They've done a lot of work to correct deficiencies that they've had, and they will continue to come to the committee meetings and give updates.
Is there a second?
Burkhart, second.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed? Any abstentions? Motion passes.
It was moved to approve the revisions of KAR 60-17-101, 102, 103, 104, 105, 106, 107, 108, and 109 as presented.
Is there a second?
Andrew Goldsmith, board member, I second.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed? Any abstentions? Motion passes.
That concludes my report.
Okay, thank you. If you would like to take a moment or drink of water. I'll turn the meeting back over to you, Madam Chair.
Okay, education committee, we did investigative committee.
Thank you, Madam Chair. I think Linda summarized all the good work we're doing and making those benchmarks. So we have one motion to approve today. I move to approve KSA 65-1123 injunctions, KSA 65-1126 invalidity of part, and KSA 65-1127 immunity as written.
We have a motion. Is there a second?
Second, Sharp.
Any discussion? All in favor signify by saying yes.
Yes.
Any opposed signify by saying no. Any abstentions? Motion carries. Thank you, Becky. How about Andrea, CNA? Maybe, okay.
I want to thank Lori for chairing the meeting yesterday. We went through several items pretty efficiently, so I have just a couple of motions that go through the items that we were. It was moved to approve the consent item agenda, which included IOA statistical report, provider relinquishments, and update on CE program.
We have a motion, is there a second?
Edric Goldsmith, board member, I'll second.
Okay. Any discussion? All in favor signify by saying yes.
Yeah.
Any opposed signify by saying no. Any abstentions? Motion carries.
It was moved to approve the long-term provider 5-year renewal application from Kansas Home Care and Hospice Association.
The motion, is there a second?
Sandra, I'll second.
Any discussion? All those in favor signify by saying yes.
Yeah.
Any opposed signify by saying no. Any abstentions? Motion carries.
It was moved to approve the long-term provider 5-year renewal application from the University of Kansas Medical Center, AHEC East.
We have a motion, is there a second?
Second.
Any discussion? All in favor signify by saying yes.
Yes.
Any opposed signify by saying no. Any abstentions? Motion carries.
It was moved to approve the initial long-term provider application from Part of America Professional Network with note about updating bibliography.
We have a motion, is there a second?
Michelle, very second.
Michelle. Any discussion? All those in favor signify by saying yes.
Yes.
Any opposed signify by saying no. Any abstentions? Motion carries.
It was moved to approve the initial long-term provider application from Pulse Transport LLC.
We have a motion, is there a second?
Burkhart, second.
Any discussion? All those in favor signify by saying yes.
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 Any opposed signify by saying no. Any abstentions? Motion carries. Thanks, Andrea, appreciate it. All right, APRN committee. We chaired that, yes, we did, you did, yeah, thank you very much.
I do have some amendment, motions to read, Madam Chair. And in Melissa's absence, I did conduct a meeting.
Thank you.
And we have a new group and we had a productive meeting.
That's good.
I move to approve the consent item agenda, which included APRN programs approved for licensure.
We have a motion, a second.
We'll go to Nate, I'll second.
Any discussion? All those in favor signify by saying yes.
Yes.
Any opposed signify by saying no. Any abstentions? Motion carries.
I move to revise KAR 60-17-104 to state preceptors can be MD, DO, APRN, for licensed health professionals with a health science degree at master's level or above.
We have a motion. Is there a second?
Second.
Okay, any discussion?
Any questions?
No, just.
All those in favor signify by saying yes.
Yeah.
Any opposed signify by saying no. Any abstentions? Okay, motion carries.
Okay, and our last one. I move to revise KAR 60-17-105 to require 750 practice hours in the curriculum. Number of hours over 750 can be precepted with a licensed interdisciplinary professional with a health science degree and master's level or higher. Practice of 750 or below must be precepted with MD, DO, or APRN.
We have a motion. Is there a second?
Get it.
Tyson, I'll second. Okay, any discussion? Anything else you want to say?
Anything that we need to, we had healthy conversations about going back and forth on the definitions, the preceptor and the appearance, and then the hours. It was a conversation. It's been a conversation for a while. So we came up with a solution, I feel. I'm comfortable as long as other parents are comfortable. Right.
Right.
And we met the deadline for today.
That's great. You had a productive meeting.
Yes, I
That's a hard topic. Yes. All right. All those in favor signify by saying yes.
Yes.
Any opposed signify by saying no. Any abstentions? Motion carries. Thank you, Betty. Thanks for doing that. Jumping in and leading the group. Yeah. Lori, you want to do practice committee?
Thank you, Madam President. And so I apologize for not being there in person today, but I really appreciate being able to Zoom in. We did have a meeting yesterday. I was there in person with the practice committee. Couple of things. Linda kind of touched on in her report, the IV hydration. We had discussion about a task force that's been put into place with some representatives from us as well as Board of Pharmacy and Board of Healing Arts. So she will come back with updates from those continued task force meetings. They are also working on the frequently asked questions that they get for calls, and will be coming up with something to present to us to apply to the website. So maybe it will cut down on the number of calls we get. We did have 7 regulations that we were looking at a final review of, but had some additional comments to add to that. So she's going to add those to those and represent in June. So I don't have any motions from that meeting.
Well, thank you for the update. I appreciate you balancing schedules and being present today.
Yes.
Okay, and I think our final committee is the finance committee, and I might hand it back over to you if you're sure. So we met this morning and reviewed the budget, and I have a few motions here for some of our regulations, but I really don't have anything significant to share. It was moved to approve consent agenda items, which include the final review of KAR 60-4-101 and an update on our upgrade to the licensing software.
The motion, is there a second?
Bonet on second.
Moved and seconded. Any discussion? All those in favor say yes.
Yes.
Anyone opposed? Any abstentions? Motion passes.
It was moved to approve KSA 65-1118 fees as written.
Motion, do we have a second?
Burkhardt, second.
Any discussion? All those in favor say yes.
Yes.
Yes. Anyone opposed? Motion passes.
This next one, I might give just a little bit of background on. We were notified by the KBI director that the cost of fingerprints is going up. That's a pass-through expense for us. So we simply charge our licensees what it costs to get fingerprints done. Because that price is going up, that we will be charged. We've made some adjustments. It is a complete pass-through. We are not making any money off of this. So it was moved to increase the fingerprint fees to $57 effective July 1st of 2024.
Is there a second?
Second, Sharp.
Is there any discussion? All those in favor say yes.
Yes.
Yes. And opposed? Motion passes.
It was moved to approve KSB in articles of the finance committee as written.
Is there a second?
Michelle Terry, second.
Any discussion? All those in favor say yes.
Yes.
Opposed? Any abstentions? Motion passes.
Thank you, Scott, for being here. Thank you. Okay. Let's start on our unfinished business. I think the board retreat strategic plan draft. Carol, would you like to
This starts on page 14. I was actually directed at the last meeting to take the feedback from the retreat, and that's actually listed on page. Yeah, okay. Page 24. So I took that content on page 24 and I kind of put it throughout the present strategic plan, where it needed to be. So the additions from that report are in red. Any deletions that I did, because maybe there was different language or something now, those are strike through. And then what's in blue here is I started putting in some of our performance, but I'm not anywhere near being done with that. I just kind of started on that since I was working on this anyway. So, I guess it's up to your discussion whether you want to accept these or you want other changes.
Any questions for Carol?
See the work. I appreciated inclusion of the legislative engagement, because you're already doing a lot of that anyway, so.
I would like to make a motion.
I don't have a motion that we accept. And just probably,
Just consensus, is there any objections to this? Okay. Okay, well, thank you very much, and we will appreciate the work of the board. This gets rushed over here in a matter of minutes, and yet it takes hours to prepare and put all of this information together and to really work through these things. So thank you very much for all of that. We'll might want to talk about our upcoming strategic retreat. We want to talk about that now?
I think Adrian has some updates, maybe.
Okay.
We're working through the final contract, so we're still inking that out, so I won't say the location, but we're looking at the Salina area, assuming that we can get those contracts through. And then likewise, we also have a facilitator in mind. We are still working through that as well, but Dr. Stephanie Ferguson is a person who's worked with us at the National Council of Safe Words and Nursing, does a wonderful job with strategic planning and that sort of thing. So we're working out the contracts with that as well. Hopefully we'll get her secured down. The dates of the retreat had to shift just slightly one day to be able to get the location that we're looking at. And so it would be Tuesday, June 25th and Wednesday, June 26th. And we would do similar where we have the, the afternoon of the first day and then basically part or however long of the second day. We did have some topics that we were potentially going to look at discussing. I don't know if this is the time you want to talk about that or not. A couple of them came up and investigated that we might be talking about. So I'll let Linda hit on those. But one of them that we discussed in Finance Committee is with all of the cybersecurity compliance and those sorts of things. The SEC has requested that boards that are publicly traded have cybersecurity governance as part of their board initiative because it is an owned responsibility, not an IT one. And so we thought in the spirit of that for good governance that we would look at potentially altering maybe the Finance Committee or adding another one, possibly calling it an audit committee so that you do the finance and then whatever report outs on cybersecurity we're doing. The plan is to do different policies every quarter, so it would be nice to be able to bring those to the board so that they can see it just for pure transparency. And then, of course, we would have the leadership governance part probably on the first day is what I would guess would be primary focus on that. And I might turn the other two over to Linda. I think it's something about or maybe Carol, CE for
Yeah,
opioid.
I don't know if Linda wants to talk about this, or I might be able to. There was some discussion about, possibly developing a CNE about, like impaired providers or something like that. And what brought this up is our impaired provider program, KNAP, just got approved to be a CNE provider. And I believe their intent, they're going to do presentations to students, but they also are interested in doing some presentations to nurses to get them more knowledgeable. So we had kind of thrown around, and I haven't talked to them about this, so, thrown around possibly if they could do one, we could somehow record it or something, put it on our website and make it into maybe an independent study or something. But again, I've not talked to them, so this was just brainstorming there. And then I think maybe they wanted a little bit of discussion about number of members in committees or something along that line, because sometimes we have problems getting quorums or something like that. And then maybe absence. Yeah, different things like that. I believe that's what I heard around. Linda, is that correct?
Yeah, that can remind me, yeah.
I was thinking of something about investigative timelines, maybe having some research or something about it.
Well, I don't know if they were gonna do some more talking about the 60%.
I think I'm just gonna kind of monitor
Okay.
it from what I
Okay.
gathered for right now and just report and kind of see what our barriers are to not meeting the metric. It's kind of where I thought we ended.
Okay.
If it becomes such that the committee wants to do something, then they'll bring that forward, but.
And maybe a report back.
A discussion about core CNEs, if they should be required, if there should be some level of education because of the volume of opioid related and substance abuse related cases that we're seeing, if there should be some kind of response to that, looking at some kind of mandatory segment of CNEs every 2 years.
And I think also possibly you were gonna report back about how it was going with the every 6 week investigative, because that was kind of discussed at the last strategic
Well, we
thing.
could.
So could fill maybe everybody in on that.
That means I have to go.
I'm sorry. Well, somebody else.
2 days from June the 30th. I didn't know whether I was gonna be there or not.
Madam President,
Yeah.
I did pull some numbers, and so it's like, we had 65 cases on Monday, but in January, we had around 35 or something. So if you didn't do and every 6 weeks, then we would have had about 100 cases, yes, on Monday. So that would have been a day and a half
Yeah.
for investigative committee. So I know it's a lot to review, but they do a great job, and it's a way for us to kind of cut down then the time that the investigative committee is committed on that one day.
Yeah.
Because we were 4:45, almost 5 o'clock
Yeah,
before we were
they're
done,
complicated.
and then we started, and it was,
Yeah.
we had a couple breaks, that was about it, so.
And just for the record and transparency, I kept track of I did all of my reading on Sunday. It was 9 hours of review of those.
And that was only 438 pages, so it's.
Right.
Could have been worse. It's been worse.
Yeah,
Well, yeah, not to scare people away, but it's a huge commitment, I think, we've talked about it, the board members really need to be apprised of that level of commitment.
But I think the issue is quorum too, because if we have to have somebody recuse themselves, then we don't have quorum to make a decision of probable cause. And in that case, we have one right now that's been held over now twice because we didn't have quorum. So it's kind of holds out being able to take action on that licensee who's still working.
Well, and I think that's good discussion. I think we ought to bring that up in our strategic retreat and that can play into our committee assignments. We did increase the number of investigative committee folks, but then that changes quorum, and so we can get into all those details, I think, at our strategic retreat and make sure that we have that balanced just right. So. Great discussion, and again, I think this goes to show the transparency from investigative committee, which has improved so much during your tenure, Linda. When I first came on the board, I mean, I think it was almost, no, I don't want to say it was secretive, but just the motions and the information that came out, it was not as robust. And so it's good to have these discussions and this knowledge. And we're still finding things that we need to change and make adjustments to, but it is so much better than what it was. So great job.
And we're also working with one attorney at this time.
Yeah, correct. We have an open position, so we had that open position.
And
now
that's
for
not feeling
a
very
while,
fast
so-
either. Apparently, they're not getting applications for that either, which is very frustrating for us.
The fact that the team is doing the miracles that they're accomplishing.
Sure.
So if we're fully staffed, then watch out.
You'll have lots.
I'm taking both of that.
Well, we are looking forward to our strategic retreat. Please make sure you've got those dates on your calendar. That is in addition to our board meetings, so I'm excited about that. Adrian, thanks for all your planning work. I know there's others in it. Takes a village. Okay, I think we have an update from the Business Workforce.
Yes. Hi, Amy Garcia and Barbara MacArthur from the Kansas Nursing Workforce Center. So 2 short things today.
Do we have her PowerPoint? I'm sorry, I didn't mean to interrupt you.
That's fine. We can work with it.
They
or
do.
without.
1 second.
If we have it, I just maybe get it brought up. Thank you.
As she brings that up, we want to say thank you very, very much. You voted unanimously in December to allow us access to data. And today we want to talk about what we're doing with that data and the next steps. Great, so you can move forward. Next slide. Yeah. And our mission is to ensure that every Kansan has access to quality nursing care when and where it's needed, and to support the nurse as an individual and member of the healthcare team. So you have a written copy of our progress against our strategic plan in your packet. You'll go to the next slide. If you have any questions about that, we are absolutely delighted to answer them. So we are taking the data that you provided us. The National Council of State Boards of Nursing gave us access to the Kansas data from the National Nursing Workforce Survey. It's a very rich set of data about nurses and nursing in Kansas. We will be combining that information with information from other agencies, labor, commerce, and other associations. They have a very robust report to the public on the state of nursing in Kansas. That will come out the first week of September. We will print at least 1,000 copies so that there are hard copies for deans and mayors and employers, associations, and the legislature, hopefully as a source of truth about nursing. So we will have a full report available electronically, and then about 60 pages in a hard copy format. We do have an additional data request. So all of the data from the National Council is state level data. In order to de-identify it, there's no county, no zip code. So in order to have a really coherent report that's useful across Kansas, Because it's very different in the east or the west or the city or the rural. We need licensure counts by county.
So I would just share, we heard 2 weeks ago now at NCSBN that there is a lot of work being done from a workforce perspective at the national level. And with multi-state licensures, the answers are going to come beyond a state wall. And we heard that from our bordering cities when we put forth the multi-state licensure. NCSBN has dedicated its resources and really looked at things from all states, and they are working with AHA to partner and look at solutions outside of just a home address, which really doesn't indicate where a nurse is working. And it has more to do with, you know, getting workforce data. And American Hospital Association is working to gather that from employers and not from licensing agencies as much. So that is where all of our data goes. There's an opportunity for you to do some core requests if there's something specific that you need from us. But we are really partnering from a national level and trying to work on providing that data from a perspective outside of just the four walls of Kansas. We heard that from the cities that are along those borders, and we see that in our data that comes forth with multi-state licensure.
Yeah.
So I would encourage you to use the processes that are in place if there's something additional that you.
So the National Council did direct us back to a core request here in Kansas. So you can, we will take care of that.
Okay.
Okay, very good.
Thank you very much.
We had one other short thing. You had asked us a question last December, and I think it came up in September about how nursing workforce centers in other states are structured. So in your report on page 4, there is some information, and Barbara's going to talk a little bit about that.
Thank you. And I'd like to add my gratitude to the board for our presentation this morning and for your support in the past and ongoing. One of the things that we discussed with you and you requested was to learn more about how centers across the country, and there are 42 of them now, are funded, what the sources are funding for what we call the National Forum of Centers. And again, you have this data in front of you. Almost a third, 32% of the centers are funded by nurse licensure fees. The second largest source of funding is 24% from state or local government grants. And the third largest source of funding is 21%, which reflects financial support from the parent organization, recognizing that the state centers are located in various parent sites and so forth. So that's 75% of the funding, and then there's the sprinkling of other sources across the other centers. So we present that to you just as a reference, and we have the opportunity, as we discussed with you, to work closely with those national forums and understand their sources and their fund utilization. And we wanted to share that with you.
I appreciate the information. There's been a lot of work in the state to keep our fees down, and our budget is managed pretty precisely. The work that is done through NCSBN goes through our relationships there, and we do not get charged a specific fee, and that does not then attribute to our licensees. So it really looks at things from a national perspective, and like I say, it takes into account that multi-state licensure, and not as much about the home and where an individual might live, but more about where they work and how they migrate throughout the country. Honestly, that is the trend that we are seeing. So yes, I appreciate the information. Thank you very much.
Thank you.
Any questions? Move on, 11:15. Let's do board member job descriptions, code of conduct.
Yeah, this starts on page 56 in your board packet, and this was a direction that was given to me last meeting, that we've had some discussion, or you all have had some discussion about possibly the need for like a position description and code of conduct. This came from the retreat discussion last year, with the thinking that this could be shared with the appointment secretary in the governor's office, so that it could be out there as far as possibly what would be the expectations of this position, because I've heard some of you say that there is some time and is a working board, definitely. And so I think it probably would be helpful for people to know that when they're thinking about being appointed, just to let you know, we have no discussion with anybody that's thinking about being appointed or gets through the appointment. We never hear anything out of the governor's office until I get notified that this is a new board member, this is the term, this is their contact information. So it's not like we can share with them, this is what would all be entailed. So what I did is I worked with some different ones out there, some through other state boards of nursing and stuff like that, to come up with a position description that does include responsibilities and then competencies. And then the following page is like the code of conduct. And again, this is just a draft, so it's a starting place. I can do whatever you want with it.
I think it's a good standard and, to be shared at board orientation as new board members come on. But then I think also, sometimes I think it is surprising to others about how much work is done here. And this isn't one of those boards that you get to show up and not do any pre-work and, it takes an hour of your time, quarterly, and then you move on. So I think it establishes that for people that are considering applying for board seats. Maybe this is something we could, I'm just kind of thinking out loud here. I don't know if others have ideas, but it may be something we want to put on our website.
I think that would be a great idea.
So do I. Because I've had people thinking about it, but they don't know what to think about on the commitment because there's nothing posted anywhere. So even going to our board site, if they're thinking about it, at least get some feel.
And I've talked to several people that I've said, when an opening comes up, I really would, and I've never heard of it. What do you do? So I think that would be a tremendous help.
I do too. Absolutely.
I would encourage a little more specificity when a normal person attends quarterly assigned committee and board meetings. I don't think they're thinking 3 days of committee and board meetings, so I would add that. And then I would also add something about the time commitment or the cybersecurity, that's probably another, 6 or 8 hours a year at least, of review. So I think just being.
And Brenda, it might be really helpful. I'm thinking about NCSBN when they put together, they have officer elections and position elections every year, and they're very clear in that that's part of that, process that they go through, that they really talk about when they're seeking applicants for those positions. And they share with you how many travel meetings versus how many virtual meetings and the length and number of days in those meetings. So it's concise and easy to digest, yet very clear on what you're signing up for if you choose to go through one of those election processes.
And then something about maybe culture and practice that it's expected that majority of meetings attended are in person, although a virtual option is available. Those are kinds of things we're putting in our, you're expected to be here, we make an accommodation for virtual, but you can't just go virtual for 3-4 years. But
Right.
Unless we have.
unless
No.
COVID, unless we have another pandemic.
For 3 or 4 years, yeah.
Yes, we did.
But I thought that covered everything from my perspective as a relatively new board member.
That's
But
fantastic.
I think getting to some of the hours and time commitment, just so people are really realistic about. And can talk to their employer if they're
Right,
employed, or how much time they're gonna need to take on their personal time.
And me also as a new, I consider myself a newbie and still much to learn. I think that expectation of the number of committees and what those committees would involve in terms of preparation, I know with the education committee, there is a lot to read and absorb. And then there's the surveys that you go on, I've been on too. And then I'm newly appointed to the investigation committee, even though I had CCNE reaccreditation survey and then HLC back to back. I did review those documents. There was what, 400 pages of,
This last time.
for the investigative committee. It does.
Yeah, it was
this-
kind of short this time.
And even though they're, you know, it is not like reading a textbook. Nonetheless, it takes time and not just to go through it, but you really do need to know what's involved with that and it takes some time to process. I think that would be helpful. Not
Well,
that we
and
need to
each
go
of
into
the
a lot of
committees
detail, but.
really does have in-depth reading and processing, and you have to come prepared to, you know, I think about education, I think about investigative, I think about even the
all
CNE committee, they all take.
They
a
all
lot.
need
They're in.
preparation prior to coming to the meeting, even the board. you know,
Even
that's-
finance committee.
That might be something to put in there too, just a heads up that there is an expectation that you come prepared.
Yeah.
Instead of just plop down here and start reading your stuff now.
I think it is in there on
Too fast,
number
is it?
2.
So this also serves as a good document.
Oh, yeah.
Should you have to document with your employer conflict of
Yeah.
interest? I had to do that with my, to make sure that I wouldn't be servicing any of my direct customers. So this is a nice, concise, and safe document. as well.
Okay, so, maybe website sorry, go ahead.
Thank you. One thought, you know, we've had a lot of success with kind of like the one pager. That's really, you know, nice, like the nurses thing, the glossy, I guess you would say. Maybe something along that lines of from a high level, what to expect. I mean, I'm thinking in my head, but would something like that be nice so that we could maybe, I won't say market, but, you know, brand what that position would be like for a board member,
I think,
maybe even committee member.
I always try to put in the newsletter when there's going to be openings, because occasionally I'll get people that will email me or call and say, hey, I'm thinking about that. You know, how do I do it? So, you know, I put them in touch with the appointment information at the governor's office. But when I put that article about the openings, I could include this information.
And a one pager.
My
love
thought
that
on
one
the-
pager.
From the newsletter. Pardon me? I found out about the opening on the board through the newsletter.
I swear sometimes people don't look at newsletters.
That's the only
We
way I
put a
know
lot of
about
work in them.
Was through the newsletter.
But I think, Adri, what you shared too about folks approaching you, what does that mean you're on the board? And even whether they're interested or not, I think it's good education to get out there. I mean, I would carry a few around.
Actually, I try to let them know when we have things like the now nursing, but CE broker and being on the board and what it means and, oh, you seem like you'd be a really good addition. You know, those kind of things, because word of mouth is really. And like I said, I didn't know there was such a thing, and, you know, these have a lot bigger degrees and, you know, they haven't heard.
Yeah.
And as somebody said, I don't think they're reading the newsletter.
It's pretty evident. Have you read the? No, that's helpful. So thank you. Carol, this looks great. I don't know that we need a motion to approve, but I think, Linda, I'm gonna add.
I noticed we have it for the board members. Is there anything like this for the committee members? So that they know the expectation also as to what is needed, because they're just as essential in the committees.
I think that's a good point. This is new we've developed this, so maybe that's something that we could look at. It might be an abbreviated.
A lot of little
this.
piece of paper on 1, 2, 3, 4, 5, without probably blindly not even knowing exactly how much work is on each one. That might be helpful.
Yeah.
Wouldn't it be? Besides reading the requirements and the regulations, which was kind of hard to understand what that committee does time-wise.
That's a great suggestion. I think
Could
maybe that's a
could
good.
we approve this with just those few other additions? So you don't have to bring it back, just on some of the time or something.
And we'll try to, we'll see if we can get that one pager or to give to you all at the retreat. I'm looking at it.
Oh, I'm sorry. But.
Anything to make it-
Second, I'm sure we could probably get some.
Yeah, that way, you all could have some in case you have people ask you,
That'd be great.
stuff like that. So we'll work on that.
I like it. Thank you very much. I think that's really helpful for you too. Okay, I think any opposition, probably do consensus on this one too, so any opposition? Okay. How about our KSBN article revisions? I think we've been reviewing them in all of our committees, so you've probably seen them a couple of times already this week.
I did include in here the changes that have been made, or if there were no changes made. And then some were done this week. So those, of course, are not in here, and I think I overlooked it investigative. I believe looked at it and said no changes, correct?
Did we?
Okay.
We didn't change anything.
Okay.
All right, I need to make sure that, but I think there's a lot more getting done now, just, FYI, there's still this whole section that I presume maybe board members are gonna look at, before it gets to the committees. It talks about meetings and, your officers and what they do and stuff, so I don't know if that's something that you guys are gonna discuss at some point. And see if you want any changes in it.
I guess I kind of assumed we were gonna do that here. That's the
Okay.
piece that
Okay.
I think falls to us then as the overarching board. Do we need time to review this at a later meeting, or are we prepared to discuss this now? I may have not assumed that correctly. So, any concerns?
I even looked at the HRA committee, and it looks like that.
Yeah.
That's what that's doing too. It describes what that committee is doing, so I don't see any issues with this document.
So. The attendance is in here. That's what, we've kind of talked about the importance of that. And Brenda made a comment about, maybe saying to ourselves that, we do have a virtual option, and there are times, and Lori, I'm not picking on you, you're usually here in person, so I don't mean anything by this to you individually at all. But there are times, I think, when a virtual option is helpful in these days. We live in a fast-paced world with a lot going on, so that is necessary at times. The idea is to be here in person if you can be. We have a much more robust discussion and healthier decisions, I think, but we do allow that option. And then attendance is important. It's important to keep up. I had a family emergency and missed the December meeting, and you do feel like you're behind when you aren't able to attend the meetings and the committee meetings and keep up on what's happening. So, missing consecutive meetings could result in not really understanding where we're at and the action steps that have been taken and progress. So I think there's encouragement to be.
Refresh my memory, is there a number of this what page is that?
Well, it's just something when it talks about,
Did it say, I can't remember if it said a number.
It did, I thought.
it does, because it talks, there's a section about, it's actually section 5, and it would be page 60 in there. It talks about the board may request voluntary resignation, which should mean, and one of them is failure to attend 2 consecutive.
Oh, there it
meetings.
is. I see.
Yeah, so, or failure to participate in committees, you know, whatever.
And it says without acceptable justification, so, even with justification.
It makes it really hard. You know, during my tenure on the board, we did have a person who, I think due to personal things that came up, missed more than one meeting, and it did become cumbersome. It does get difficult though, because we are at the liberty of the governor appointing additional people. So we've seen points in time when we have not, we've struggled to make quorum, in all honesty, because then if one person, another person is absent or sick and our seats aren't full, then we get into some difficulty. So I think the way this is worded gives us a little bit of leniency, yet I think it's healthy for us to discuss that. So I just throw that out there, Adri, that I would hate for us to tie our hands.
Well, I wouldn't, but again, it's on the individual to understand how much their participation is essential.
Yes. I was just curious how they got to the number 2 in there, and how do you monitor that and therefore enforce it when you put numbers like that in policies and then they get caught in a corner. I just was wondering why they did that years and years ago.
Well, and it says without justification. So I
You know,
think
that's true. And what's the definition of that? I mean, I sound like
Well,
a nursing
if
instructor going on.
But if you're quarterly and you're missing 2, you're missing half.
Yeah,
That's
that's true. That's
50%.
50%. Maybe that's probably where the 2 came. Now that makes sense.
Yeah.
I just have a comment. It seems like, the expectation is to be in person, but the last minute, I need a virtual Zoom. Kind of creates, extra work on staff at the last minute to make sure, because, when I get stuff on, yesterday morning and I'm texting Adrian, who's already in a committee meeting, it's like, by the way, I'm gonna need you to send, links to whoever. I don't know that he has the time
Right.
to do that. So I'm just making you aware that it's, last minute requests. We try to accommodate, but.
Well, and I think that's a good point, Linda, and I think when that request is made, I think depending upon the scenario, we have had discussions as we were coming back from COVID, whether this room would accommodate our needs any longer, and trying to do live streaming and to keep up with technologies, and even just the format of how we sit in the room and see each other. So, I think there's a lot that plays into it, and maybe that should be part of the previous document, that it is an option available when it can be, but there may be times when it can't be, right?
And that could be. I appreciate your comment.
Do we want to approve these articles as they are? Do we want to make revisions to them? Carol?
Just FYI, I don't think all the committees have looked at it.
Okay.
Okay. So,
Let's, we looked at the articles of finance. And we didn't do all of our others, but we did look at our articles.
so do you want me to just put this in next time and just write, who has looked at it? Because
Okay.
I think most of the committees we look at, but I have to go back through.
Let's just validate, and then that'll give us more time to think about it. Okay. We did our strategic planning retreat update. Charles, how much time will you need for our forum?
At least 30 minutes. Maybe more.
The lunch is good.
It is ready.
If you're.
Okay, why don't, we were gonna try to go till noon, but let's do our core coma after. Okay, and we don't wanna cut Charles short, so. Okay, we'll go have lunch, we'll
It's up-
adjourn for,
Did our,
it's upstairs.
Yeah,
in the
and I might ask you, I don't know when they're gonna do it, but, we're gonna be doing some updates and some stuff that we gotta do on your laptops. So if you can, make sure you save everything. Cause we might have to sign you out to get that back on.
And leave your laptop here, is that
Yes, that would.
okay?
But we turn them off.
No, you can leave them, I mean, you can leave them on, but
Sign
just
out.
if you're gonna
Yeah, just
save
like
anything.
to leave or something else.
Is this room gonna be locked?
There'll be
Uh,
somebody down
some
there.
would have.
Can you see sign up?
And if-
I mean, you could leave it on and just,
then you'll just
we might have
sign
to
in
move it.
back.
So,
But other than that.
staff.
Okay.
We did this.
You can leave it on.
How about if we do come back about 10 after 12? Does that sound okay? That's time for a restroom break and then have lunch and.
I think they're gonna install the stuff while we're in executive session. Just
Okay.
wanted to make sure you saved anything you had. You don't have to rush.
So, right about 10 after.
Got to sign back.
Okay. Back in a bit.
you very much. And I wanna, as we come back together after lunch, we'll regathered here. I wanna take just a minute and send our sincere appreciation to Colton specifically. I tell you, I call him periodically and he has to very gently tell me that most of the time it is operator error. And he is very tactful in the way that he says that. And he is just incredibly responsive. He does a phenomenal job. You know, I'll go a few weeks and not talk to him, and then all of a sudden I'm blowing up his email and he always just responds so kindly and he keeps us all functioning electronically. So we appreciate what you do, Colton. Thanks for putting up with me specifically and anyone else who might have difficulties getting in once in a while.
That is not a problem.
Password.
That's
I had to,
Yes.
I sent Adrian a message. I did it again.
I'm glad to hear that. You know,
It doesn't like me.
I totally understand. Well, there's so many passwords to the, you know, the email or logging into the computer, all the different things.
Don't write them down.
Yeah. Don't write them down. Don't write them down. Okay, we appreciate our IT team for sure. So do. Okay, Charles, I'm sorry we put you right after lunch.
No, that's fine with me.
We're gonna have our annual Cora Coma training.
That starts on page 71 in your packet, just FYI if you want to follow.
So this particular iteration of the board member training is 17 pages long. I'm just going to go over some of it, but you're responsible for knowing all of it. So as I go through it, I'll mention page numbers for stuff that you might want to look at later. I'm sure y'all read the whole thing before the meeting, so we're probably good. So, as you know, agencies are a creature of statute. All of the power that you utilize comes from the statutes in the Nurse Practice Act and other acts and from the regulations. In exercising regulatory power, members of the licensing board they often struggle with the issue of what their authority is and what their authority is not. At times, board members want to exercise discretion when there is not any allowed. For example, when the statute or regulation uses shall. At other times, board members do not want to exercise discretion when it's authorized. For example, when the statute uses the word may. To exercise appropriate and lawful authority, a board member must understand the board's governmental role. A board is considered, I said that. As a board, you may only administer and implement the statutes that give you authority. The Kansas State Board of Nursing administers, implements, and enforces the Kansas Nurse Practice Act at KSA 65-1113, and also the Licensed Mental Health Technicians Act. So it talks more about that on the first page. Toward the bottom of page 1. For licensing boards, the general purpose, whether explicit or implied, is to secure for the people of Kansas the services of competent, trustworthy practitioners and to protect the public against unprofessional and improper, unauthorized, or unqualified practitioners. It is not to promote the profession as a whole or to protect individual members of the profession. And, sometimes some of the boards forget that, so that's not the case here. On page 2 now. So the board has kind of quasi functions of all of the branches. They have judicial authority, which is an adjudicative function to enforce the enabling act by holding due process proceedings and hearings to determine whether violations of law have occurred, and thereafter issuing orders that include findings of facts and conclusions of law. In serving in a quasi judicial capacity, a board follows the Kansas Administrative Procedures Act, or CAPA, to achieve uniformity among applicants and licensees, as well as various agencies, the state, with respect to procedural safeguards. You have legislative authority, and that's the authority you have to adopt regulations in order to implement it or interpret legislation applicable to your board. In adopting rules and regs, a board is required to follow the Rules and Regulations Filing Act. And that's mentioned elsewhere in here for several pages, but it just goes over the process for how you promulgate a regulation. To increase your effectiveness as a board member, bear in mind that the less time, money, and energy and resources are expended in preventing a legislative post-audit review, a lawsuit, an appeal of an administrative action, or a complaint against the board. That is, if you know your statutes and regulations, you can avoid those things. So I recommend that you read the Enabling Act, establishing the board and its practice, reread the Practice Act, especially as a statute pertains to a specific issue or matter, reread them as necessary to familiarize and understand the boundaries contained therein, read the regulations and reread the regulations. Be on the alert for agency policies and internal procedures which are inconsistent with or conflict with statutes and regs, or impact requirements for applicants or licensees. The phrase, "we have always done it this way," is not a legal defense when you have to go to court. So ensure the decisions are within the authority granted. If there's any doubt about the legality of an action, consult with your board's attorney. Also, be willing to initiate action to amend statutes and modify regulations. If a statute or reg is confusing, unfair, vague, or overly burdensome to you, chances are that it's confusing, unfair, and vague to the people that are obligated to comply with them also. Remember, the role of the board is to protect the public, not the licensee. So you guys were talking about responsibilities and codes of conduct earlier, and starting on page 3, there's sections on that you can read. I'm only going to read a little bit of it. So I know sometimes boards have conflicts of interest. So some of the board members do things outside of work or things that can impact this. So it's good to read. Conflict of interest typically means having any interest, financial or otherwise, direct or indirect, or engaging in any business or transaction or professional activity, or incurring any obligation of any nature which is in substantial conflict with the proper discharge of your board member duties and the public interest. Board members must make public and recuse themselves when there is a conflict of interest to ensure the integrity of the board and all of its decisions. Disclosure and recusal are important tools to avoid actual or perceived conflict of interest, but more board members must not overuse recusal as an excuse to avoid conflict in exercising their full duties. And then it talks about different examples. There's personal conflicts, personal gain, bias. Which you can read for yourself. Confidentiality on page 4. At all times, the board member must conform to the rules of confidentiality in dealings outside the boardroom. Protected information obtained in the capacity as a board member must remain confidential during and after board membership. Termination of board membership does not dissolve the board member's responsibility. The rules that apply during active board membership continue to apply after termination of board membership. Confidentiality must be maintained on all confidential subjects that the individual was privy to as a board member. And then it talks about what goes on during executive sessions. Everything that happens in an executive session is confidential and can't be repeated outside of that. Ex parte communications, it talks about when you're in an investigative capacity or on one of the disciplinary committees, you got to be careful about who you talk to and when. So you can read more about that on page 4. The Rules and Regulations Filing Act is on page 5 is just a process for how rules and regs are promulgated. If you're not sure of the process, it's useful to know there. When you promulgate a reg, if you're going at warp speed, it takes like 9 months. It's almost more arduous than making a statute, so. Okay, now I'm on page 8. The Kansas Tort Claims Act. The Kansas Tort Claims Act generally governs the liability of the state of Kansas and its agencies and employees. As an employee, that includes members of boards of a government entity, including elected or appointed officials and persons acting on behalf of it or in service of the government entity or in an official capacity, whether with or without compensation. So that includes you guys. The basic rule of the KTCA is vicarious liability for an actionably wrongful act or omissions of government employees within the course and scope of their employment, subject to affirmative grants of immunity that may exist on a case-by-case basis. Lawyer must have wrote that. So if you are sued for an act that occurred within the scope of your duties as a board member, you are entitled to have the Attorney General's office defend you at no cost. To obtain representation by the Attorney General's office, you must submit a written request to the Attorney General within 15 days after the service of process and include a copy of the petition and summons. And you must cooperate in your defense. The state may choose not to defend you if you acted with actual fraud or malice or failed to make a timely request for your representation. A 2-year statute of limitations typically applies to lawsuits governed by the KTCA. Former board members are covered, employees under the KTCA, for acts and omissions during their former employment period with the boards that were within the course and scope of their duties. So that's important to remember. At the top of page 9. The general rule is that the state will pay for any judgment rendered against you unless the judgment is for an act or omission that occurred outside the scope of your duties as a board member, or you failed to cooperate in your defense, or you acted with actual fraud or malice. So things to remember. If you get sued, you got to tell the Attorney General within 15 days. You got to cooperate with them in your defense. So also, if you are sued, do not sign anything and do not say anything to the people that are suing you. So anyone have any questions on that?
How often have we been sued? As board members? How often have board members been sued?
Not often. It hasn't happened since I've been here. All right, the next thing is the Kansas Open Meetings Act, or KOMA. I'm just gonna read parts of this too. The Kansas Open Meeting Act allows the public to observe governmental entities making decisions. Meetings shall be open to the public because a representative government is dependent upon an informed electorate. Because the purpose of KOMA is to benefit the public, it is interpreted liberally and exceptions are applied narrowly to carry out the purpose. KOMA applies to all meetings for the conduct of the affairs of and the transaction of business of all legislative and administrative bodies and agencies of the state, political and taxing subdivisions, including boards and subordinate groups like your committees. KOMA does not apply to otherwise covered entities which lawfully use quasi judicial functions when deliberating matters related to a decision involving such quasi judicial functions. So when you're investigating a complaint and conducting investigations and discussing that, that's not an open meeting. That's an exception. Also, what your board or subcommittee is called is irrelevant. So work sessions and retreats are subject to KORA or KOMA. I'm at the bottom of page 10. Executive sessions are governed by statutes. The statutory requirements for an executive session are: 1, a formal motion has to be made, seconded, and carried. 2, the motion for an executive session must contain a statement describing the subject to be discussed without revealing the confidential portions. The justification, which is usually a citation to a statute, the time and place the meeting will resume, and the complete motion must be recorded in the minutes and permanently retained by the board. So that's why when you have a motion for executive session that's in writing, and you just read it verbatim into the record. Discussions in the executive session are limited to those subjects stated in the motion. The justification for an executive session is listed in subsection B. The 2 most common ones are personnel matters of non-elected personnel and consultation with the board's attorney. Executive sessions for personal matters of non-elected personnel are used to protect the privacy interests of the employee. And there's more to read there. Toward the bottom of page 11, the penalties for a KOMA violation include a fine of $500 against each board member. So that's important to remember, not the board. For each violation, ouster from office, recall from office, court costs assessed to the board to the person seeking enforcement of KOMA, and court costs are some penalties. And there's more on that. Page 12. Now I'm at the top of page 13 for the Kansas Open Records Act. The Kansas Open Record Act requires the board to have its records open for inspection by any person unless otherwise provided. That KORA shall be liberally construed and applied to promote public policy. The bottom line for you all to remember that anything you write, including electronically or record, that has to do with board activities will be available to the public. So any email you write that's work related, any comments that are in your emails are open to public scrutiny. So always be very careful when you're putting things in writing in an email. Sometimes it might be just a good practice just to pick up the phone and have a telephone conversation. A public record includes records in existence at the time of the request, and a board is not required to create a record to fulfill a request. So written records includes photographs, computer data, emails. So, when you get a core request, the request must be acted upon as soon as possible, but no later than the 3rd business day following the date of the request. There's 3 responses are acceptable. Number 1, the record provided, if the form requested if possible. Number 2, the request is under review and the records if permitted will follow. And 3, the request is denied with a detailed explanation for the denial. And you also have to have like a statutory reference if you're going to deny a record request, usually. Under the core, there's a presumption of openness. As such, the requested public records must be released unless a discretionary or mandatory exemption to disclosure applies. The burden rests on the board to prove the requested records are exempt from disclosure. The board may recover actual costs for fulfilling a record request. That can include staff time to retrieve, review, and redact the information, to copy it and to mail it. The fees may be estimated and collected before the records are provided. In actions brought by the county or district attorney or attorney general or core complaints, the fines are up to $500 for violation, for a knowing violation, or an intentional failure to furnish information. And then there's more on page 15 and 16. Page 16 goes into the Kansas Administrative Procedure Act, or CAPA, and that's what covers your licensee hearings. And you can read more about that there. I won't go over all that. And that's all I've got to cover right now. Does anyone have any questions? Got a knot in your stomach?
Who wants to sign up now?
Maybe like a real newbie question as it relates to email. I know we never hit reply all, right?
Yes.
Which is easy not to do. I was thinking, so I had to communicate with Carol, with Adrian, and Jill. Like, is that too many people? Do staff?
Staff doesn't count.
That's what I thought, but I didn't want to assume.
Sometimes a board will send out a blast email just to see if there's availability for a meeting or something. And it's a good practice at the top when they do that to put in red capital letters at the top, do not reply to all. Because one form of a COMA violation that cities always get hung up on this. They'll be discussing an issue on emails and replying to all, and that counts as a meeting. So that's a violation because you probably didn't give notice to the general public that you're gonna have, and how are they gonna see it? And it's called the serial communication. Also, they get in trouble, someone will send an email, but they'll send the same email to everyone, like, how are you gonna know this? Like, that's a serial communication, that's also a COMA violation. But if you're just talking to staff, that doesn't count.
Okay, thank you.
Everyone else is good, you got it memorized?
Can I just add something?
Yeah.
That's why we do not push stuff to your personal email, your personal phone, because I don't think you want other people looking at your personal email and if we get a core request.
Technically, if you're doing business on your Gmail account and you're commingling those things, that could expose your personal phone or your laptop to public scrutiny. So if you have a work phone or work emails, it's a good idea to keep them very separated. all I have for that.
Thank you very much, Charles. We think. We're always glad Charles is here. He keeps us legal. Yes, yes. Okay. We have, how about we go back and look at where we're at with the legislative review process. One of your on-site meeting packet agenda items was an update I think it's called, yeah, it's OS board is what it is, but this is the regulation review progress and where we're at. I asked, we have 1 year to finish this legislative review of all of our regulations, and that's March of 2025. So we're finishing up our second group of meetings since we've started all of this. And I asked Carol to just, how are we doing? Where are we at? How are we progressing? Are we making good? I hate for it to be March of next year and we have to spend the entire week reviewing regulations. So Carol, you want to say anything and kind of tell us your coding here?
Sure. Now realize this doesn't include anything that was done this week.
Yesterday.
Because, yeah, yesterday, because there were some done yesterday, so that would look a little bit better, but all of those highlighted in yellow, those have been through the whole process, because again, the process is they're looked at in a committee. They give us ideas of what they want, then we put the form together, and then it's in your consent agenda for the next meeting. And you do yet another review to make sure that's really what you want. And then it goes to the board and the board approves what you said. So that's why there's not quite as many in yellow as maybe, but, and then the ones in gray are the ones who have been looked at the first time by the committee. And they're gonna go back to that committee and be put in consent agenda. So there were some of those yesterday in the committees that, would be through the process now, basically. These are divided by committees. You'll see that seemed to make it a little bit easier. And then like education committee up there, it says there's 25 total, 3 have been, that means totally completed all the way through the approval process. So the committees can kind of see, you know, how many they have left and stuff. Committees are doing it, I think, maybe a little bit different, and that's okay. The main thing is that they get them all reviewed. Some will decide, okay, these are the 3 that we're gonna look at next time. You know, others, what we typically do is put like almost all of them, that's what I do anyway, in the packet, because those are the ones that you have to look at by the time this whole process is done. So how you choose to do it as a committee, it's always out there that they can see the ones that they're gonna have to look at. So I thought I would update this each time, but yeah, if you go to the 3rd page on the document, okay, so you have June of 24, September of 24, December of 24, and March of 25 in June. But what you have to realize, the report that I have to submit has to be done like, I don't know, first part of July or something. And that report includes the whole 91 regulations and what was said about them and stuff like that. So I'm telling you that because you can't wait till June to do some of these initial reviews. That's not going to work. You know, you need to have June of 2025. If you have any for the committee to review, they have got to be the final, absolute final, and it's ready to go board the next day for me to be able to have this information and get the report. The report is like a mega report that has to be filled out. So,
so we really want them done by that March of 2025, leaving the June meeting for something unforeseen or, you know, Carol to tie up the report. And I think it's good for chairs of the committee to be aware of this and, transparently, we did one this morning in finance committee and tabled the other three, knowing that we've got a little bit of time. Education committee, we got through, I think we had 4 or 5 planned for this time, and we got through all of those because education committee has heftier lift than what finance committee does. So just be aware of where you're at and help us make sure we get through these timely. We don't want to fall out of compliance.
I don't want to, because I would have to go over and defend.
Carol doesn't want to defend.
Thank you.
Thank you for that, Carol. I appreciate you keeping us organized. Okay, so at 1 o'clock, we
Yeah, that's all you're looking.
yeah.
Something new that we're going to start doing, and we have it for this time, but we kind of forgot to bring it down. Oh, anyway, it's over there now. But as part of our coop and everything like that, you all come in here to do business. So you're in here for some part of 3 days, basically. So it's very important that you know what you're supposed to do in case of an emergency. I mean, typically you have a staff member with you, but if for some reason you would not have a staff member, we're gonna have the sheet that says in case of emergency guide. And it's going to tell you in a fire emergency what you would do, medical emergency, building evacuation, because you have to realize when we evacuate this building, we have to be able to, once we're outside, we have to be able to account for everyone that was in here, whether it's staff, board members, or whatever. So we just can't go out there and go hither and yon. I guess that's what I'm trying to say. Bomb threat, or suspicious, and then the one that, of course, we don't want to see, but more and more on the rise, I guess, is the active shooter and the hostile intruder. And we actually do the active shooter education for the staff, probably yearly, something like that. They come in and do it, because we're not always the favorite agency for everyone. But anyway, we just put this, and it would tell you, what the location is and stuff. If for some reason you had to call for an emergency, you had to call 911 and you can't think where you're at and stuff like that, it would be on this sheet. But again, hopefully you would always have a staff member in your committee or different stuff like that.
I think that's great, Carol. That in PSBN, there were a couple of states that talked about they've had to increase security because of concerns with folks coming into their meetings. So I think that's a good step in the right direction. So I appreciate that.
I mean, that's why we added all of the locks and everything on the agency. So you really can't even get in the lobby without someone letting you in. Because otherwise people just walked in there and then all of a sudden they're standing in front of this glass window with Jackie, and who knows what they're gonna do or something. And we're really good if we have someone who is upset with us or has not been real nice with a staff member or something and threatened to come up there. We oftentimes have security available, and we always have several of us up by the front desk and stuff like that. So we never just have one staff member standing there. We've got support and stuff like that. We've had to do that a few times, unfortunately.
Okay, thank you, Carol. Okay, so let's talk about agenda for June meeting. We've got several things on here. We just talked about the regulation review updates. Think of anything else specific? We'll already have finalization of all our retreat information, but we'll rehear that.
The articles.
Question about the retreat. Is it something we do every year, or is it just if there's a pressing need, or?
So when I first was on the board, we weren't doing them at all. And then after COVID, it was really our first meeting back together in person. And it was overwhelmingly helpful, I think, for multiple reasons. For many people, it was their first time actually meeting the other members of the board. And, you know, I think we all know what it's like to participate in electronic meetings. You don't ever really feel like you know the person until you get a minute to run into them in the hallway and, you know our backgrounds and that kind of thing. So we were doing them every 2 years there for a while, every other year, and we started realizing how impactful and meaningful those conversations were. And so prior to this last retreat that we had, we discussed the feasibility of doing it annually. And I think that's where we headed at the direction of the board is, you know, it's a day, essentially, it's a half day and a half day. But there is such robust conversation and development of our processes and understanding that's really where the work came from. That's led the investigative committee to make the changes that they've had with the transparency. And I think it's been a tremendous success. It's where we have received some guidance, if you will. Every one of our facilitators has been very strategically chosen and helped provide us guidance. I can't think of our facilitator last year, Dr. D'Angela Burns, and she really assisted us with understanding processes across the street, ensuring that our budget was set up in appropriate manners, because there's been some questions from the public about the dollars that we have in our budget and ensuring that we are using those in the right manner and that we don't have fees that are either too high or too low for the needs of the board. So she's been instrumental in that. And I think that we just realized that as a board, we need that time together as well as the direction from our facilitator to help guide us and shape us and be a more robust functioning team.
Get more done faster when the group's together with a leader. That's task oriented and focused, and we just got an awful lot done faster, in other words, instead of after meetings.
Well, and I'm pretty excited about the facilitator that and we actually have a couple of different options, and we're trying to finalize the one particular one. But I think that Adrian's done a great job of coming up with some names that we may not use them as a facilitator this year, but next year, and for the direction our board is going and the topics that we need to be discussing, you know, information security and our IT concerns is one that comes to mind. And I think that you'll see a lot of hot topics that we may not have thought about previously come up at those strategic retreats.
I'm not questioning the value per se. It's 5 days out of June then that we're taking off our calendars, and I just want to be sure we have legitimate deep business items to dig into in that retreat and not.
Strategic retreat tends to do that.
And we've had it at different times throughout the year. We tried to move it so that it was in conjunction with the budget making process, and that if anything came from the retreat, that it would be financially accounted for within the next year's budget. Because of schedules and calendars, that hasn't worked out as well. Carol will be presenting the budget.
Well, it actually is, because I started doing the budget the middle of August. So,
So it'll come timely this year. Okay.
more so, yeah.
And it would be helpful, because it is a little harder now with the state. You have to go through more hoops to get these things organized, than even last year. So if I had even a few years notice of the timeframes that you guys would like to shoot for, a couple, give me a couple options so I can get the calendar set up. It's really helpful.
And we can talk about that. So July tends to be a heavy vacation month, and I think we were kind of asked to avoid July, but we can talk about it.
I think it's the first meeting that I had ever met anybody, because I came in as a Zoom. was the gentleman from North Carolina.
Jim Claiborne.
He's the one that came up with meeting more often with the investigation. At the time, we all kind of looked at him like, you know, and now we've done it, you know, they've done it. And so they come up with stuff that it's like nobody had talked about it before, and then it's done.
Is there, so Brenda, I'm kind of, I think, reading between the lines. You would like to suggest maybe the retreat not be on the same month as a board meeting?
That would
Is
be
that
preferable. I mean, this one we already had on our calendars, I think, although I think we had the Wednesday, Thursday, and then I think it's Tuesday, Wednesday. So if we could just maybe next year, maybe make it not in the same month, that would be helpful. But
Do people have strong feelings about July and wanting to avoid July? That
I do have strong feelings.
Yeah,
I
right.
don't know if May is an option or if that's too early. I don't know.
I think that's what we originally were shooting for. It was the facilitator that unfortunately
That gave us
wasn't available in May.
And that's kind of what we're at the liberty of our venues as well as the facilitator. So, but I think that's good.
So if we had a couple option, you know, a week in there, we could plan it way ahead if possible.
With May, you're got a lot of graduations going on, but
Have to be the end.
yeah, I would think it would need to be towards the end just because of that. But I think we could certainly try to look at that for next year. And I know that we have some names of potential facilitators that we might, so it might be good to contact them now.
Yeah,
And
that would
see
be
if
really nice.
we could get on their calendars. That might give us that flexibility to have some choice.
I have one in particular in mind that would be really helpful with both executive board and investigative licensure.
So we know if
Yeah, let-
NCSBN schedules out their discipline case management conference, because they're usually right there at the end of the.
I can find that out.
June.
Yeah, I can find that out.
And
Good idea.
I like getting to that.
Yeah, and our IT systems.
They're usually pretty progressive and they
It's a good networking.
keep you updated on the need to know
Yeah,
information.
Yeah,
That was one benefit of a change in this year to the June.
yeah, I think it was June, was it June last year? And it went to May.
So, yeah.
It was like first part of June, I think, so it's always like right in.
Okay, we actually have the need for two separate executive sessions, so, we have, let's do our first one and then we'll have to come back together and reconvene and then we'll call for our second.
You should have these motions, if not, but you want the long one first. Okay. If you have a question as to which one's the long one, I'll have to speak to somebody. And Adrian, how long do you think we need?
I would give this 30 minutes.
Which one is the long?
I was gonna say, they look kind of the same.
Yeah, that one's a little longer. It is, just wait a minute. Okay. You have to read them right now. We'll just take a look at this one. I'm adding something. Sorry. No. I'll give it to somebody. Okay, who wants to read this?
There is one typo, it should be Rocky, not bad news.
There's, we actually have to use this.
Yeah, I had to use the one that I have because there's been, are you gonna read it?
Does it have hard words in?
No. it doesn't.
You should use the That's Sydney Welch. Okay. We
And
did not
30
even
minutes.
start.
Now,
Yeah.
pursuant to KSA 754319B2. I move that the board recess into executive session for 30 minutes and reconvene at 1:30. 1:30. The remote meeting will be reconvened by Zoom in room 509 Landon Office Building, 900 Southwest Jackson, I'm guessing Street, Topeka, Kansas, 66612, as stated in the notice of the meeting that was sent to the individuals who requested the notice and as published on the board's website at www.ksbnkansas.gov. The justification is consultation with the board's legal counsel, Assistant Attorney Sydney Welch, Charles Mashiers, that would be deemed privileged in the attorney-client relationship. The subject matter will be discussed in the executive session concerns legal issues regarding legal issues related to internal procedures and statutory compliance. The board's executive administrator, Carol Moreland, Director of Operations, Adrian Guerrero, IT Security Administrator, and Nathaniel Kirst and Rocky McKenzie are included as the client.
We have a motion. Is there a second?
Second.
Thanks, Ruth. Any discussion? All in favor signify by saying yes.
Yes.
Any opposed signify by saying no. Okay, we will.
Please make sure you save your work. They're gonna be installing some stuff.
Thank you, Colton. So we are reconvening back in open meeting following that executive session. So thank you for that. And we have one more executive session that we need to take. So I believe there are some.
Is it this one? Yes. Is it for 30 minutes?
Let's do 15.
Okay, pursuant to KSA 75431-9B1, I move that the board recess to the executive session for 15 minutes and reconvene at 1:45.
Let's say 1:48.
1:48. The meeting will be reconvened by Zoom in room 509, Landon Street, Office Building, 900 Southwest Jackson, Topeka, Kansas, 66612, as stated in the notice of the meeting that was sent to the individuals who requested the notice and as published on the board's website at their website. Do I need to read website? https://ksbn.kansas.gov/. The justification is to discuss personnel matters of non-elected personnel. The subject matters to be discussed in the executive session concerns an employee's performance evaluation to aid the board in its discussion. Adrian Guerrero will join the executive session.
We have a motion. Is there a second?
Michelle Terry, second.
Thank you, Michelle. Any discussion? All in favor signify by saying yes.
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 Any opposed signify by saying no. Okay, we will go back in.
All right.
All right, thank you, Colton. Okay, we are back together then in our open meeting, and I think we have completed our agenda. So without any further ado, we will conclude the March meeting of the Kansas State Board of Nursing. Thank you all very much for being here and for your participation. We'll see you in June.
Yeah, it's 2 weeks shorter. It's better for time span this time.
And the staff knows that.
Staff knows that.
And we have